This is Laura Dyrda with the Becker's Healthcare Podcast. I'm thrilled today to be joined by Chris Clay, President and CEO of HSHS St. Joseph's Hospital in Breese, Illinois. Chris, it's a pleasure to have you on the podcast today.
Thank you, Laura.
Well, I'm really excited for our conversation, but before we dive into it, can you tell us a little bit more about yourself and your background?
Yeah, I'd be happy to. As you mentioned, Laura, my name is Chris Clay. I'm the president and CEO here at HSHS St. Joseph's Hospital in Breese, Illinois. And I've had the privilege of being here at St. Joseph's Hospital for the past 4 years. I've been with Hospital Sisters Health System since February of 2009. I did join HSHS in our Western Wisconsin division, as I mentioned, in '09. I actually started with Hospital Sisters Health System as a director of rehabilitation. My background is actually physical therapy. So I worked as a physical therapist, quickly moved into director and various leadership roles, and ultimately realized I wanted to transition or grow into a community-based hospital president and CEO role, and Hospital Sisters Health System definitely provided me the opportunity to move upward within the organization. So I'm thrilled to be here in Breese, proud of the great work that's done within our hospital each and every day by our medical staff and other clinical and non-clinical colleagues. It's really a great place to be and a privilege to serve as the president and CEO here.
Well, fantastic. And, that's such an interesting career trajectory you took from being director of rehabilitation and then growing into the role of the president and CEO of a hospital. How did you, take that leap, and what really inspired you to go from one side of things to, completely overseeing an entire hospital?
It's an interesting question, and there's a couple people that were really influential in my career development and professional development. We all have people who have helped us to be successful in our careers. I refer to these people as mentors, and I think back to my first job as a physical therapist when I graduated from physical therapy school, and it was in a critical access hospital in northwestern Wisconsin, a really strong facility when it came to brand recognition, quality, safety, really high retention when it came to their colleagues and medical staff, and I got to know the CEO really well when I started working as a physical therapist, and I just watched him interact with physicians, colleagues, patients, the community, and I quickly learned or felt like that was the type of role I ultimately wanted to end up in at some point in my career. So that gentleman was definitely somebody who set the stage for who I really wanted to become professionally. And then doors just started to open in terms of leadership opportunities, primarily, director roles within rehabilitation, but opportunities with creating business plans around, expansion projects, whether it was a service line or a new clinic or a satellite location. And as those things happened, doors just continued to open. A second individual who I'd consider to be a mentor for me was, the president and CEO of HSHS St. Joseph's in Chippewa Falls. She was really instrumental in coaxing me into, furthering my education when it comes to an MHA, becoming a member of the American College of Healthcare Executives and working through that fellow credential. So really just being good people, doing good work, and having people set you up for success in terms of leadership and guidance, but then just opportunities that came to be. So it's been an interesting path, but thankful for not only the people that I've crossed paths with along the way, but also the opportunities that resulted in my growth.
Absolutely. Wow, that's fantastic to hear. And I'm wondering, considering your entire career, what do you think is the biggest risk that you've taken that paid off? And I know risk is a big word, so but in terms of the decisions you've made or some of the big things that you've done, what do you think has really been something that paid off for you?
That's a pretty easy answer for me, and it really is making the leap from, being a rehabilitation or an operations leader and transitioning into the president and CEO role. So that move for me created multiple risks. Number one, when you step into a CEO role, there's obviously a lot that goes into being in this position, from just obviously, board management to medical staff management to strategic planning, quality, safety, patient experience. Everything that happens within an organization ultimately rolls up to the president and CEO. There's so much accountability, which is great, but there's risk, there's discomfort, there's fear of failure or fear of missteps that naturally come with that accountability. So there's risk in that, but the good thing about risk in that situation is it motivates you to be good, to be strong, to be do your work in a way that is compliant and reinforces that you're representing the organization in a way that you'd want your board to be pleased with, as well as the community. But then the other component is, when I made this transition into this role in particular, myself and my family, we were relocated from in northwestern Wisconsin, which was very comfortable and known to us, to a new region, Breese, Illinois, just outside of St. Louis, Missouri, all new. So there's risk in just that personal dynamic. Everything has turned out great. So the move was worth the risk, or the risk was worth the risk, because it truly has paid off, not only professionally, but it's been a good move personally for myself and my family as well.
Absolutely. That's really great to hear. And so motivating as well. I'm wondering, what do you think you do differently that has made you successful throughout your career?
So I don't know if I do anything differently than other leaders. Everybody has a unique leadership style, and that's just based on who we are as individuals and how we've grown and developed within our careers. So again, I don't know if what I do is necessarily different, but I can tell you what I do repetitively or reproducibly, and that is being visible. It's being visible amongst my team, our colleagues, the people who are doing the work on the front lines, providing care at the bedside, providing care in the exam rooms, whether it's our physicians, our nurse practitioners, physicians and assistants, nurses, therapists, housekeepers, food and nutrition professionals. I make it a point every day to be out, to be visible, and to engage with anybody and everybody that I encounter. And those conversations more commonly are not about what's happening on their unit or what's happening with their work at that point in time. It's commonly about just personal interaction, dialogue, relationship. You build high trust with those kinds of discussions and encounters, which leads to good things when it comes to quality, safety, growth, all the things that I mentioned when it comes to accountability and tasks as a president and CEO. I don't think me doing that is different than most leaders, but what I can tell you I do is do that consistently. Right before you and I jumped on this call, Laura, I came back from rounding on patients, so I actually get into patient rooms to talk to our patients. I want to know, how is their experience going? Are there things that we have opportunities to be better at? But on the other side, what are we doing very well? And when I learn those things, if somebody's name is mentioned, I make it a point to send them a handwritten note. So it's really about relationships. I would say that is my focus when I look at our team. And when I say team, it's everybody who crosses the threshold to enter this organization each and every day. So I think that's what's maybe different. But to get to this level, you have to be really good at what you do in terms of just knowing healthcare and being able to tolerate change and discomfort. All of those things we have as leaders but it's that personal connection that I think we have to make sure happens consistently. And I think that's a commitment that I've made to our people, and it's something that I really work hard to uphold.
Got it. That's really great to hear. And obviously, so important, as you said, being able to be visible and making sure that, your team knows you care about them and are present within, their day to day. So that's great to hear. I'm wondering, how do you see growth at HSHS St. Joseph's Hospital evolving over the next year or so?
Yeah, so the one thing that the pandemic did for us as healthcare organizations, it's really forced us to be different in a couple ways. One, we learned how to be nimble, and what I mean by that is when COVID-19, became a reality for us really in March of 2020, we had to move quickly when it came to COVID-19 testing, triage practices for patient surges, to drive-through testing environments, to, standing up temporary inpatient COVID units. We did that really well, as did almost every other organization, hospital within the United States. So we learned to be much more nimble than we had been in the past. The other thing, telemedicine is now a reality for us. Pre-pandemic, telemedicine was something I believed many of us wanted to do, but there were so many disconnects in terms of the technology that delivered the platform. It was uncomfortable for physicians. It was uncomfortable for patients to participate in a telemedicine experience. And of course, on the payer side of things, there was malalignment between the service delivery and the actual, reimbursement that would support that service. The pandemic forced us into that telemedicine realm. We did that really well here at St. Joseph's Hospital, especially in the primary care market. Our primary care encounters were done virtually early on in I would say the front half of the COVID-19 pandemic, just because we were asking people to socially distance, stay home, and do all those things that we all did as Americans. So I see telemedicine continuing to grow, rapidly, not only in this market, but across the state of Illinois and in other markets across the U.S. The other thing that's really coming fast and furious is really the evolution of ambulatory services. You think about, gastroenterology procedures, outpatient diagnostics, X-ray, CT, outpatient laboratory services. There's a push to move those services into an ambulatory venue versus a hospital-based venue, based on, associated cost. So I think, from a growth perspective, hospitals like ours, we will have to be nimble in really formalizing our strategies and work in the ambulatory market, especially around surgical services, radiology, and laboratory. So that's a very large focus from a growth perspective. And then the other point I would mention is, and this isn't specific to me or my organization by any means, but the pandemic has resulted in, a lot of movement with healthcare professionals. You've seen, if you think when the pandemic started, there was the surge in the Northeast, and then in the state of Illinois, that surge happened in Chicago. And so we saw healthcare professionals kind of migrate to those areas, rightfully so, bringing the care where it was needed. But that natural movement of healthcare workers, has created, it's kind of highlighted or emphasized, professional shortages. You talk about registered nurses, hospitalists, primary care physicians. I think those gaps in people coverage are much more apparent today than they were pre-pandemic. We knew that they were there before the pandemic, but the pandemic has really elevated, the fact that, my gosh, we need people to select nursing as a profession. We need people to select medicine as a profession in order to, effectively sustain and grow the good work. So people, are specifically not a growth strategy, but we know we don't grow, we know we don't sustain without good, competent, skilled people. And so I do put people into the growth category because we need these folks to continue doing the work that we do today, but more importantly, to advance the new things that we want to do in the future.
Got it. Got it. That's, so interesting to consider thinking about how the movement of healthcare workers could have some of those ramifications, down the road for as you mentioned, the shortages. I know across the U.S. there's definitely healthcare organizations trying to figure out their staffing models and, really understanding what they need to do in order to provide great care to their communities. And as you mentioned, telemedicine as well, and then, the outpatient ambulatory services and labs and those kinds of things. I'm wondering, are there any other trends that you're following closely in healthcare today?
Yeah, again, this is really connected to, the pandemic, the trend of, hospital at home or virtual care, meaning, lower acuity patients that historically potentially would have ended up in an inpatient hospital bed actually being cared for in their own residence, either virtually or with some type of a remote care team. That is a trend that is, you talk about growth and strategy and just new things in healthcare. That is an area that feels uncomfortable, I think, for a lot of people today because I believe there's a belief that we need to somehow get there, but we're not sure what that roadmap looks like. So that hospital at home model is something that's really interesting to me because I think, again, the pandemic has pushed the value and benefit of virtual care, and I think we're going to see more of this. There are so many home health teams and programs within the U.S. today that provide a lot of hospital-based services at home, and that home health component is so vital in helping us as a hospital care for patients that continue to need that type of clinical support. But it's really the kind of that theory or thought of the hospital at home model. Interested in that. I don't know. I don't have the answers or solutions at this point, but I know it's really something that that we're talking about and wondering or thinking about how we can really drive that to becoming an appropriate reality.
Got it. Yeah, that'll be so interesting to see how all of that plays out. Well, Chris, thank you so much for joining us on the podcast today. This has been a really fascinating discussion, and I look forward to connecting with you again soon.
Right, Laura, thank you so much for your time.